How does cultural awareness shape the approach to dementia care or program development and community support in your organization?
Yes, I think there's a really big gap in that section where, as we're seeing the numbers now and the projected numbers of people with dementia and the Black community in particular, we need to be more mindful of the need for culturally relevant programming, to incorporate into programs for people with dementia. So that's something we've always pushed at the ACCA, the need to connect with seniors at where they are, not where we want them to be, but where they are, and having cultural programming, things that, even the songs and things that you remember, the culture, because, when you introduce music to people with dementia, how alive they become. So when we develop curriculum that respond to the cultural aspect of the people with dementia, I think we'll see more engagement. And we also want to make sure that we put food as a huge piece. And right now, every Wednesday, we have a chef from the Caribbean or from African inspired meals to make sure that their diet and their health considerations are considered in the programming. So I think it's a really critical piece. The other piece is the whole idea of spiritual and emotional support that is missing often in these kinds of programs in the general community. And based on our demographics and based on the age, that's most of the age people are getting dementia. They're very spiritual or religious people so want to be mindful of their practices so that we infuse aspects of it to create as normal as we can in our space, a space where they can actually be supported on that journey. So we really believe and strongly support the need for organizations like the Alzheimer's Society to really push for more of that as well across the different geographic regions where they serve, and partnering. One of the key pieces, partnering with organizations that have a cultural framework to do this work. So the research certainly backs that up, that we need to have more supports, culturally relevant support. Research in the United States speaks to that. And I know aspects of this research by Dr. Ingrid Waldron also connect with that. So I think it's really important to value that. I'm very a little anxious because of the numbers that I'm seeing in terms of the projected numbers of Black people. And I also know in the Indigenous communities, quite frightening. It's frightening for everyone. We know that people as human beings, we are frightened by it. But in the Black community, the whole stigma attached to this kind of presentation is really concerning too. And I like what Ms. Haughton said earlier. Everybody is a little joke in the Caribbean community, at least in Jamaican community. It doesn't matter what you have, you must drink mint tea. Okay, you broke your arm. Did you have some mint tea? So people like to go to what they know, like our herbal remedies. And I'm not knocking it because I am also a consumer of that. But that's a really good point you raise in short. So you don't really maybe make fun of people wanting to do that, but really help to guide them in that process when you have people with dementia in your organization that we are knowledgeable about their culture, so we can respond more appropriately, especially in day programs. Ginger tea, of course, cures everything. And it must be a gas that causes it, right? Yeah, the wicked gas that causes every ailment.
And now I'll go to Ngozi and ask, how does the organization ensure that Black community members are aware of and able to access dementia-related services and support?
So what we do at the Alzheimer's Society, provincially, locally as well, and even nationally, we go out into the community and we do partner with different community organizations or individual community members to disseminate knowledge and information. There's been a couple of initiatives actually with the Alzheimer's Society of Canada. So if you go on their website, if you Dementia in the Black community, there are a series of videos that have been developed that speak to, these are folks all over the country who have spoken about their experiences with dementia in their family, to offer a source of support, a source of understanding and validation for other people's experiences. We're also going to be developing a community awareness campaign with Caribbean Vibrations in the next couple of months, targeted specifically for the Black population across Canada around stigma, risk factors, management factors for dementia. Outside of that, though, we do tend to work with different community organizations, again, as I said, to disseminate relevant information within a cultural lens where we can to different groups of the of the African diaspora in Canada. So we do have that. Those programs initiatives starting. To Evelyn's point, it is very concerning the numbers of dementia we see in the Black population. Earlier this year, the landmark study was released by the Alzheimer's Society of Canada. They gave a projection of dementia over the next 10 and 15 years and what we can expect to see in Canada. And we do see a substantial increase of dementia in the Black population. So thinking proactively to get people thinking about dementia and to really start looking at risk factors is very important as well.
What has been the most meaningful support that your family member has received, and what resources do you wish were more accessible?
One of the most meaningful resources that we received was when we realized that we were able to have support workers come and help to relieve some of the stress on the family that's taking care of my father consistently, because there is the burnout factor when there's just a small amount of people taking care of this one person all the time, and they feel burdened and tired and frustrated. So having a support worker come and help an hour or every other day or whatever really did help, especially as his condition gets, I don't want to say worse, but as it gets more severe, right? Because he's still able to do a lot of things for himself. I wish we'd known about that earlier, and like being that it's my father, when you're telling your parents that you should call the society and check out these things, sometimes it's challenging for them to access those things because maybe they don't have the skills, like computer skills, and fear too. So if the fear wasn't there, I'm sure that they could have accessed help a lot faster, and also knowing what they could access, because in our case, there's a lot of things we didn't know. We had to start reading and researching to find out what we could do. So the best thing was having support outside of our family, and what we wish we had known earlier was where we could go and get support, because it wasn't readily available at the time that it happened in our family.
How do you think we can raise awareness within the Black community about the early warning signs of dementia?
Okay, I'm going to talk specifically about my situation, only because put it this way, we are most in the Black community, they're very religious. So I would think going out into religious assemblies or something and letting them know that there are pamphlets, and maybe even offering to do workshops or something like that, to let them know that these things are available would be really beneficial. Maybe in schools or community centers, having things out there, letting them know that, hey, because when we started realizing our father had that, that's when people started telling us, oh, my mom had that, or I know a cousin that had that, but it's unfortunately very secretive and tend to keep this to ourselves, which is, it's unfortunate. So if information is spread in the places that the Black community is, I think that would really help. That's what at least in my cases. But anywhere you can give information, that would be good. I think of the Heart and Stroke Association, how they come to, because I work with children, they come to our school and they start talking about heart disease and simple way of like to know the signs, and they're starting from grade 1. So they go home now and tell their parents, we learned this. I'm not saying to go to the grade 1s and say, but I'm saying maybe in the school, having things that they can bring home and give to their parents to read, even that might help, but just try and get it out any way you can, because there is a lack of information.
Can you share some of the recent research findings related to dementia and the Black community, and how does this research influence your organization's work?
Yeah, and so in Canada, we don't collect race-based data yet when it comes to dementia, when it comes to most chronic illnesses. But what we have seen consistently from the US and the UK is that Black populations, we experience the highest prevalence of dementia. So we get dementia more than other communities. We can also get dementia faster than other communities. Now, with that being said, there's a couple of caveats that are really important to note. In Black populations, we tend to get diagnosed later on in the trajectory of the disease. So if we might be seeing symptoms maybe when we're 65, 66, we won't typically go get diagnosed until we're in our 70s, right? By then, a lot has happened, right? By then, getting access to certain certain treatments, certain drugs that can help slow down that progression, that time frame has passed. Additionally, there's a lot more burden placed on the family because they've been going through all these changes without knowing what is actually happening and getting those supports. When it comes to access to healthcare services, in the research that we have seen around the world, Black populations, we have disproportionate access to adequate healthcare services. We have a lot more discrimination that we face. We have a lot more issues with healthcare providers taking our complaints seriously and putting us on the right medication. We can be institutionalized at lower rates, so we don't technically go into long-term care settings. That we tend to stay at home longer with our families until when we get to long-term care settings, we're a little bit in a crisis point. There's a lot more health issues, a lot more health needs related for the family. In terms of types of dementia, Black populations were more at risk for Alzheimer's and vascular dementia. So things associated with high cholesterol, cardiovascular issues, stroke, things like that. We're more in tune with vascular dementia. We also can get dementia younger than other groups as well. So dementia typically, it's not a normal part of aging. Not that you're going to get older, you have to get dementia, but we tend to see dementia in later years of people's lives. But for Black populations, we can get dementia younger. So in like early 60s, late 50s, mid 50s. The risk factors for our community are very unique. So risk factors for dementia include things like smoking, drinking, poor eating habits, isolation, depression. But there's also one that we face specifically for discrimination. So exposure to discrimination, racial discrimination, can actually have an impact on the brain. It can actually change the structure of the brain. It can age your brain faster as well. And you can experience more cognitive decline and cognitive impairment just from prolonged exposure to discrimination. So a way to protect yourself against that is looking at ways to moderate against stress. As we get older, we need to rely more on our social connections as opposed to staying more isolated. And when you get isolated, you become depressed and anxious, and that can have an impact as well on your trajectory for dementia. When it comes to ways to combat it as well, like from a clinical perspective, getting a diagnosis as early as possible is very important, because then that puts you on the right trajectory for the right interventions, the right drugs, and the right community supports. I will make a note about caregiving, because I am a caregiver as well for my father who has dementia. We experience disproportionate burden when it comes to caregiving. Black populations burn out a lot more, and especially Black women. Black women are the ones to mainly do the caregiving, and there's a double burden that Black women face with taking care of loved ones who have dementia. There's a lot of stigma in our community, so oftentimes, even though we might have family members around, sometimes family may not want to be involved because of the stigma of dementia. As well, when it comes to caring for young children at home and then caring for an older parent, you're in that kind of sandwich generation. And for us, we can actually caregive to the point where we literally burn ourselves out. It can impact our jobs, impact our relationships, and that can be very detrimental to our health. Another research finding is that people who care for someone with dementia are at risk of getting dementia themselves, because they're under so much stress all the time. They don't have a break, they don't give themselves a break, and that stress can impact their cognitive impairment as well. So making sure to really look after yourself, taking care of yourself, making sure that you take time for yourself is really, really important as a caregiver, part of the journey. Being able to ask for help, reach out for supports that are available to you, culturally specific supports where you can find them, and if not, other supports where they are available. Working past the stigma and guilt and shame is also very important. And there are some resources and supports for that as well to help folks with that.
What are some barriers that Black seniors face when trying to access support for dementia, and how can we overcome them?
Okay. The barriers include the lack of awareness of the support that's out there. How many people know where to go when they do present a problem? So that's a big issue, like educating them about what the programs are, but at the same time, make sure the programs are relevant and culturally appropriate. So when they do go there, they are welcomed and valued and respected. So it's always constantly working on both ends, the client end, and also advocating for improved services, relevant services. Also, there's still a mistrust of the healthcare system, right? Understandably so. So oftentimes people delay going to get medical support because they don't trust the medical system. So that's a huge issue that we have to work on, building trust At the same time, really identifying the issues that are faced by Black people in the medical system, because that is still remains a huge issue across Canada, United States, UK. The body of research that points to second-grade treatment of Black patients is very much a reality. Also, the idea of stigma associated, which has been talked about already, no need to, but the whole idea of stigma associated with dementia. Some people, some cultural communities in our diverse Black communities, certainly there are questions about, what causes it. Is it karma? Is it something someone did? So that's a huge concern still. So we have to constantly educate community members, build awareness, create programs like ambassadorship program, and really make the language accessible. When you look at the demographic internal immigration patterns, and people who came to Canada in the 50s and 60s, they're the ones, by and large, presenting a lot more dementia because of the age, right? And when we look at what was their educational level when they were coming to Canada, most of them were brought into Canada through what we call the Foreign Domestic Worker Program and other laboring programs. So they did their work and go home and raise their families and do their best to make sure they have a healthy household with their family, but they really didn't take enough care of themselves. So they're not really aware. Many of them are not aware of the issue and where to go for support. The educational level among that population is, by and large, of course, is not very high, and they're not really connected to communities. They go to the church, and Sundays or Saturdays, and then they get home, but they don't really get involved in the community. So that's another area that we need to work on, is to create programs and educational programs to talk about dementia at their level. The Bible in Jamaica now, they put the Bible in patois so that people could understand it. So we got to find creative ways to present this information. So it's not really necessarily scary, but it's informative. What is the role of the different stores that we have that people purchase their foods from? What about the role of the religious institutions? What's the role of the hairdressers? What's the real role of the people that support communities, organizations like the ACC? So really getting back to grassroots and really connected at that level. So it's not this academic research. People get like, oh, it's over there. It's really right here. And that's something we have to put some energy in, really getting to the people. So they they have earlier interventions. I was reading recently, and because I'm also forgetting everything, and I'm thinking, oh my gosh, but yeah. So I was reading about, and I didn't even know, and I'm educated, like HRT. I've never even thought about hormone replacement. And now I'm reading some research talk about, I'm like, oh, but I've never even heard that you're supposed to be mindful of your estrogen level and what it means to dementia. Maybe, I don't know what you folks think on the call, but I was just online reading something about that. I'm like, oh, I don't even know what my estrogen level is. Maybe I should, because there's a connection to dementia. I don't know. And I know my mother would be like, what the heck is HRT, for example, right? So I think there's a lot of education that needs to take place as well, but at a very grassroots level. And in people's language. So right now we have a very high Caribbean population because of trend immigration pattern. In the next 10 years or 20 years, you'll see more continental Africans presenting because of the immigration pattern, right? Who was here first, and as they get older, you see a different shift. So we have to prepare for that, as well.